I'm delighted to be here today with the lovely backdrop of a very grim, murky Manchester today. It was quite breezy yesterday and bright. I was actually here the year before last and had the pleasure of co-chairing the Network's annual conference then. So I'm delighted to be back again this year to co-present with Sam, who's sat over there, really about all the work that we've been doing around motor neuron disease, or MND, across the breadth of Greater Manchester. Actually, Yvonne's introduced us, so I won't do that again, because you now know who we both are. But we've been asked here today to talk about the collaborative approach, and it really has been a collaborative approach we've taken to trying to improve MND care in Greater Manchester, working as a three-way partnership, and that's between the MND Association, ourselves, who commission the work, and the MND Care Centre, who we've worked with for many years, and I'll tell you a little bit about that in a moment, and the Network, who deliver the contracted work on the ground. I should mention at this point that the two sort of main practitioners on the ground who have been involved in this particular collaboration are Christina Federico. I don't know if Christina's here today. No? She's working. She's online. Hi, Christina, who's our dietitian at the Care Centre, and also Killian O'Brien, who I've still not seen today. Is Killian around? Hi, Killian, who's taken on the role of our MND project facilitator on behalf of the Network. And just as a bit of a disclaimer, I should say that myself and Sam have shamelessly taken a presentation that Killian and another colleague at the association presented elsewhere, but we've tweaked it for today's audience, so there's a little bit of us in there as well. So, if I click, hey, has that worked? Brilliant. So what is MND? I didn't want to assume that everybody in the room today would know exactly what this disease is all about, although awareness around this particularly devastating disease has risen really exponentially in more recent years. I think due partly to a number of high-profile cases in the sporting community, so quite fitting that we're at AJ Bell Stadium today. Particularly in the world of rugby league, which I know nothing about, so apologies if there's any rugby league fans in the building. And you probably know about the case, or will have seen about the case of Rob Burrow, who's pictured in the slides, from Leeds Rhinos, and his friend and teammate, Kevin Sinfield, who's been involved in raising lots and lots of money through his 7 and 7 in marathons, as well as raising awareness. When I started with the association some 9 years ago, I still had to explain to family and friends and colleagues what motor neuron disease was, and thankfully that's not quite as it was then. But just some key facts about MND. It is a fatal, rapidly progressing disease, and it affects mainly the brain and the spinal cord. It attacks the nerves that control movement, so muscles no longer work basically. And people find that they're basically locked in a failing body and they're unable to move, talk, and eventually breathe. So a lot of people living with motor neuron disease that we work with will need non-invasive ventilation, NIV, to breathe, and some will choose to have a feeding tube or PEG as well. About 80% of people with MND have communication difficulties, and I think that's part of the devastation of this disease, where people actually will lose their voice for those that have bulbar onset or go on to have bulbar problems. About 35% of people with MND, we now know, have some mild cognitive impairment, and about 15% of those people might go on to develop frontal temporal dementia, which results in more pronounced behavioural change. It does kill about a third of people in as little as a year, and more than half within 2 years of diagnosis, so it is very rapid. It affects about 5,000 adults in the UK at any one time, which is a relatively small number in comparison to the neurological conditions I know, such as MS and Parkinson's. But I think that the disease is particularly devastating and quite complex and requires quite a lot of health and social care professionals surrounding that individual and their family and carer. And currently there is no cure. So at the MND Association, we aim to improve care and support with people with motor neuron disease, their families and their carers. We run a counselling service, for example, in partnership with Bernardo's for children and young people affected. We fund and promote research into research for clinical trials, new treatments, and hopefully bring us closer to a cure. And we also campaign as a charity to raise awareness around the needs of motor neuron disease. So back to the local context in Greater Manchester. Just to say that whilst this three-way collaboration within the network has been in existence since 2022, the MND Association has a long-standing relationship with Manchester Care Centre, who've been working with for about 22 years now, which is a bit bonkers, isn't it, Sam? But it is 22 years. There have been some great pieces of work together over those years. So it was the first MND care centre in the country to train volunteers in their clinics. And we have one of our volunteers, Sylvia, I believe, over in the corner today, if you want to go and visit our stand. It was also one of the first to work with the local health and social care partnership to develop services for MND carers and those with early onset dementias. But the use of our MND Association grant to begin to improve the local MND care pathway in Greater Manchester has very much set the scene and context for the current work that's being undertaken. This work has led to the care centre being involved in NHS England's development of our recently published MND Optimal Care Pathway, and Greater Manchester has featured as an example of best practice on the NICE website. I oversee 8 care centres in the north of England, and I talk about Greater Manchester probably a lot more than I should, but unapologetically there's some really good work happening here. Now working with the network, we are realising a real opportunity to further develop those pathways for the approximately 250 patients living with MND in this area and their families, and that moves us closer to addressing those inequities to accessing care, depending on an individual's postcode. So we currently fund the network and the care centre to focus on 2 areas: nutrition for people living with MND and the MND care pathway as a whole. So I'm now going to hand over to Sam, who'll talk about that work in a bit more detail, which I'm very grateful for because I'm not a clinician. And she's going to talk about access to community services, significantly the neuropsychological care and support that's been shown as a gap, specialist neurodietetic care out in the community, and most importantly we'll share some of our patient experiences which hopefully brings some of this to life. And then I'll come and finish off our presentation with some points about next steps and what we're going to be doing next. Okay, Sam. I'm probably just going to sit down there while you talk.
Thank you very much, Tracey. And a big thank you really to a number of people that are in the room actually that have helped us along the way, both recently over the current period that we're going to describe today, but also historically, the support that we've got from many of you in the room. Okay. So this was a pathway that was developed probably now and published about in 2020. It came on the back of the NICE guidelines for MND, which were published in 2016. And at that time, it represented an opportunity for us as a care centre to look at the work that we were doing currently and how the NICE guidelines fit in, or where we might need to be really structuring our support slightly differently. You can see on the PowerPoint that this came from before a diagnosis was made right through to bereavement care. And it certainly set the scene in thinking about MND care in Greater Manchester. As a result, as Tracey said, of this work, we were on the Good Practice Guide on the NICE website, and we were also invited to the National Neurosciences Advisory Group. That led to a document that was then published in June of last year. Now, ahead of that document being published, so this is now National Optimum Care Pathway for people living with motor neurone disease. Ahead of that, because we had our pathway, we were already starting to think about how do we take our pathway and our findings to strive to achieve equity for everybody in Greater Manchester that was living with motor neurone disease. And the partnership with the network gave us a great opportunity to move closer to that goal. As Tracey identified, we looked to recruit for 2 posts. One would look at nutrition and the other would look at the opportunities to develop local services. And I'm going to describe examples from each which demonstrate the differences that both posts have made to date. Okay, so the first step in taking the pathway forward was meeting with our community colleagues, many of which are out here in the community, in the audience today. Sorry. We also have a twice yearly steering group, and there was an invitation that was put to all professionals working in Greater Manchester to join that group. And it's been absolutely amazing, the number of people who have joined and have really helped us to move things forward. There was an opportunity to map the current services and to see, do all teams supporting people living with motor neurone disease have the same professional membership, which leads us quite nicely onto Killian's findings. So across Greater Manchester, we've a number of teams, not all of them neuro teams actually, looking after our patient group. Each one dedicated to making a difference to people living with MND. All areas have an occupational therapist, physio, speech therapy, and access to dietitian, and in most cases, nursing support. But the workforce in each of those teams does change, is very variable, and we are linking in from the care centre with each of those teams. 12 out of 13 I call Manchester 3, because we've got 3 teams within Manchester. I know as a network you would class it as 1. So 12 out of the 13 localities have access to specialist community neurorehabilitation. But as you can see there, we have got some areas that it's actually not the neuro team that look after the people living with MND. And the variation in those teams has led to some inequitable access to some services and the delivery of care. And I'm going to focus today on the neuropsychology and the specialist support that would bring. So at the time of our review, 8 teams had neuropsychological support in their team. What does psychological support and emotional support look like for people living with MND then? How do people living with MND access psychological support? Tracey identified to us earlier that half of those diagnosed die within just 18 months. So neurological support and neuropsychology support is available to some people. For some people it's counselling, wellbeing hubs, mental health networks, local hospice support, the MND Association, work-based initiatives, wellbeing at work, and genetic counselling. But there was lack of equity across what's available for everybody in Greater Manchester, and that is at the heart of everything that we do. The waiting times for some of these services, it's not timely access for many people. It's really important to us, and we've heard already today about the importance of understanding what it's like to live with MND, and that's not just the person with a diagnosis, but their carer, their children, their friends. And that the person who is providing that support understands MND as well. That the person that's providing that support can accommodate somebody with changing voice ability or with some cognitive changes. And for us, knowing what's available out there is really important, but also what's required. And as our previous speaker identified, the patient's voice is really important. Asking people living with MND and people with a lived experience, what is it that would make a difference to you living with MND, and how can we get timely access to that support? So in this area is the basis of our next development with both the network and the MND Association, and we hope with people living with MND and many of you too. We also heard earlier about the therapists that were being trained with ACT, and hopefully that will also, we will be able to pick up which of our teams and which of our patient groups have got access to trained workers. Now some of the findings from the nutritional support. So we found that in just 3 of the community neuro rehab teams, there was a dietitian within that team. So there was no access within the MDT in 10 areas, although there was an outreach to dietetic services available to everybody in Greater Manchester, it does have to be said. But there was varying triage models that led to inequity and waiting times and waiting for review and ongoing proactive discussions around interventions such as gastrostomy tube. Christina Federico works on scoping the current situation, and her work identified to us that the specialist neurodietetic service within a CNRT, there would be an average wait of about 1.5 weeks, with a review time about every 4 weeks. By comparison, looking at a dietetic service within an adult community team for a group of patients in Greater Manchester, the average wait was 5.4 weeks. And the average review 10.7 weeks. Quite a difference, really. The recent survey showed that higher levels of confidence in managing nutrition and supporting with tube feeding discussions for MND among specialist neurodietitians compared to dietitians in the adult community team. So the higher levels there of being able to work as an MDT, understanding MND and being able to together, even some areas would do joint assessments with speech and language therapists and the nurse, or a dietitian and the speech and language therapist or dietitian and the nurse. And here's 2 patient examples, just to illustrate that. So the first was a gentleman who was diagnosed with MND and lived within an area that had a CNRT dietitian. The referral was made to the community neuro team at the point of diagnosis, and at that time there was no nutritional intake concerns at that initial assessment. However, being proactive as a team, that individual was seen after a week after the referral, and some discussions took place in relation to maintaining weight and avoiding some changes. Within just a few short weeks, it was identified that there was a little weight loss, and it did initiate some feeding tube discussions. Having opportunity, as you know from working with your own patient groups, to talk about something with an individual, give them time to think about it, ask questions, return to that topic is so important. invariably, people don't make a decision on the spot. You need this today, or you need this soon, right, okay, I'm ready to have it. So I think that going back and forth, being able to develop a relationship with the person living with MND and be able to talk honestly and openly about the benefits of the intervention, I think was definitely one of the positives for this gentleman's group. And he had the gastrostomy tube placed within 4 or 5 months of his diagnosis, and shortly after he started to use the tube for full nutrition. And he's currently still having review by the community dietitian to make sure that we've got it right. By comparison, Liz, diagnosed in 2020, was a lady who was accessing support via a separate dietetic department. She did experience some new difficulties with eating and drinking, but she wasn't known to the dietetic service, which then led to an 8-week referral for input. The differences, I think, come when somebody is mobile. So if you are mobile and needing to access services in some areas, that might mean that you need to be under a different team. So there was a GP referral and a wait for this particular lady. Whilst she was waiting, her weight was reducing. She was very keen actually to talk about dietetic support and keen to talk about early intervention for a gastrostomy tube. And because we were waiting, she did actually come back to the care centre and meet with Christina. Eventually the tube was placed, but as you can see, it's some time after the initial discussions. I don't want to miss anything. Okay, I'll just go back there. So the first, I just want to make sure I've not missed anything. And it is important for me to also say, when Christina's done her work, she has included the patient voice and has some patient feedback. I do believe that the work that we have highlighted and the work that we do together will not only positively impact those people living with MND, but I think it can improve services for others living with neurological conditions. And we've already heard today how, you know, the pathways that we've been working on can certainly be looked at in other areas too. Because if we get it right for people with MND, then I think we have the potential of getting it right for lots of other people. I'd like to hand back to Tracey, because she's going to share with you now some of where we're up to and the take-home messages.
Thanks, Sam. So what we've achieved to date, we've identified what the gaps look like and where we need to focus our efforts. So we've created quite a lot of opportunities for clinicians to network and cross-fertilise those ideas and share resources, which is so incredibly important. We've now got regular locality MDT meetings across the borough that meet bi-monthly. We've developed a Greater Manchester-wide contact directory of all those working with MND, which can be used for referrals, discussions, peer support, etc. And we've created, as we mentioned earlier, the steering group across the breadth of Greater Manchester, which meets twice a year. And that brings stakeholders from across all of the community teams to meet with the Care Centre and the MND Association. There's been a local MND toolkit developed with online educational resources, which incorporates, amongst other things, some very key bite-sized videos for learning and development, which clinicians have fed back have been really helpful. We have an online MND training programme to upskill clinicians, which you can all access. And we've held an educational event or a study day in October with a second planned in April. And that's been really well attended and has enabled us to have a real cross-directorate of different professions and teams. And they've shared learning around lots of key areas, including respiratory care, nutrition, psychological care, advanced care planning, and communication aids. Really importantly, we've raised the profile of MND and the pathway development. We've represented at various stakeholder groups, including a presentation at the ICB Clinical Effectiveness Group recently. And we will be measuring the impact and distance travelled through a transforming MND care audit that we've devised, which incorporates patient stories as well. So finally, what have we learned and what's next? Well, the main takeaways, I think, for all of us has been, and it's very fitting because we've got a slide behind here or a stand, the benefits of collaborating across teams, across localities, across different organisations, spanning the statutory and third sectors is so important. And the realisation that service improvements can actually be cost neutral. They don't have to cost lots of money. There's a real return on investment in that sense. So, you know, a real difference can be made to those people living with MND and their families and carers, for very little cost, maybe 1 to 1.5 hours per month from a clinician's time. And how we've also learned how we're now able to utilise the Greater Manchester model, and we have been doing wherever we can, as a real exemplar for further care pathway development within the area of MND. So future developments will be, we're now going to embed that key learning to become business as usual, hopefully. As Sam said, we're looking particularly at emotional well-being care pathways. Looking at the areas of genetic testing and counselling, which very much obviously go hand in hand, and also looking at gastro pathways, working in partnership with the North West Ventilation Service. And finally, possible future investments would include the inclusion of dietetics within the community neuro-rehab teams, greater access to psychological interventions, which is something we're seeing across the board. And lastly, the Care Centre at Salford Royal and the network here are working on the next grant application to ourselves as a charity as we speak. So it's very much about watch this space, I think. I hope that's been really useful and hopefully inspired people in the room to think about how they can collaborate with others through partnerships and alliances to improve outcomes for those living with a neurological condition. As Sam says, the work that we've done here is really applicable to anybody, really, any patient group that is living with a neuro condition. So that's it, I think, from us. I don't think I've missed anything out, but happy to take any questions.